Good evening, dear friends. Well, today we finally find out what the Shay is, where it is located, and what its function is. The mystery is solved. British scientists have finally figured out that it consists of 7 vertebrae in us. Since we are mammals, fed by mother's milk, like, for example, giraffes, they also have 7 vertebrae. Imagine that. The neck is long, and there are people with a long neck. But everyone has 7 vertebrae. Those who have a short neck, for example, your neighbor Zenaida Petrovna, and you with such a neck like a goose, you also have 7 vertebrae. And so does the giraffe and the hippopotamus. Everyone has 7 vertebrae. That's how it is. Everyone was given 7 vertebrae. But there are anomalies. Some vertebrae fuse, for example. But it is also considered just 2 have fused. And today we will finally find out with you what to do so that our brain with you. Where is your consciousness located? Here in the brain, we perceive the world with our eyes. The main sensory organs are located in the area of our head. Food also enters through the oral cavity. We breathe through the nose. And all this whole bag of bones, blood, and organs is alive. He must provide your brain with constant pleasure, constantly giving you something new, a new series, a new candy to taste. You constantly need new impressions from life. But for all this to function, all this also needs to function. The heart pumps blood, the lungs breathe, the stomach digests everything is in order, whatever you put into it. The liver also successfully secretes bile. The gallbladder secretes bile. The urinary bladder, the intestine throws all this out. And all for what? So that your brain works. Remembered where your apartment is, home, where you put your phone, where the keys are. You don't remember anything. And why? Because all this can work perfectly or somehow, but it works. But the result of all these biochemical reactions should only reach your brain through a few arteries. Its blood supply should still somehow, but happen. What can we do? How can we help improve the work of the brain, ears, eyes, mouth, nose, teeth, everything that is in the head area? Firstly, we can maintain good blood flow. But it's still unknown what kind of blood it is. If it's bad blood, nothing good will come of it. If it's bad blood, we'll improve blood flow so that you have less of it in your head. At least fresh blood would come there. Is movement important? It's important. You need to turn your head to find out what it is. Who clicked on you there? To run or which way to run? Towards him or away from him? Do you need to be able to look up? You do. Because sometimes you need to find your way by the stars. For example, if you get lost somewhere and don't know which stop it is. Here, please. The Big Dipper, the North Star, move in their direction. The sun, too, a solar eclipse. With one eye in the binoculars, the other can also look. Subscribers complain of too many conversations. Let's discuss more. We won't talk much, okay? We won't waste the film for nothing. So, friends, how can we affect our fate? We can affect it with muscles. Improve the condition of the muscles. We can improve the condition of the movable joints. Can we? We can, if there is a desire. We can also improve the condition of the vessels. So why don't we do this? The question arises. Let's go, as they say. Forward, then. He said this in English. So, we need the sternum-clavicle scapular muscle. It has such a name because it was named so according to anatomical attachments. The sternum is right here. Why is it called that? Well, 3 scientists have discovered. Grudinin, Sostsvitsev, and Kluchitsin, you think? No, just 3 attachment points. Sternum. And maybe Grudinin discovered the sternum. First discovered. The key in the pineal sprout on the high bone. We have this pectoral clavicular, correct, the pectoralis muscle. Next, the long neck flexors. To simplify, there's not just one muscle here, but many muscles. We combine them into a large complex like this. The long neck flexor. From the mid-chest section, there are the fourth and fifth thoracic vertebrae. The occipital bone is where a large group of muscles are located, with the short neck flexors underneath. Right here. Well, of course, we drew the front here, but imagine here that they are like this. Several muscles are also located here. Vessels, nerves, spinal artery pass between them. Here are all the participants of these phenomena. The spinal artery passes in its own canal, has its own canal. Not every artery has its own canal. Here it is, look, right here, inside the bone canal. Have you ever seen such an artery in your life? Now you know it exists. Both the right and left spinal arteries are yours. It goes into the skull base, joins there one with another, right, left. And also the internal carotid artery, which has branched off from the common carotid, approaches them. External carotid, internal. And here, all this in the skull base, all these arteries are somewhat joined by anastomoses. Anastomoses are such formations that connect several arteries. This is called the Circle of Willis. Willis, a native Roman scholar apparently, who first discovered this. So he opened the skull base, looks, a circle, it turns out. The first one to see it, so I'll call it Willis. That's what they started calling it. What's the function? We close one artery with a dam atherosclerotic plaque, for example, or for example with what? With some kind of bone growths, strong arthritis, or some kind of muscle spasm, such a good one, suboccipital, and the blood still flows through other arteries, just like that. We close another artery, two others still save the day. Close everything, stroke, at least a stroke, or there could be other symptoms. Various symptoms can occur. That's why we need to avoid all of this. And what are we going to do with you now? Two large muscles, the sternocleidomastoid muscle, the long neck flexor, please. The sternocleidomastoid muscle. Here it is, represented here. How am I going to train it now? How am I going to train it? I can train it sitting, lying down, turning my head. The main function is head rotation. Anyone who has, for example, problems with head rotation, if it's hard for you to turn your head, start with this. Anyone who has problems with noise in their ears, headaches, it can also help. The nose gets stuffy. By the way, the most interesting thing is when there is a weakness of the sternocleidomastoid muscle, such a manifestation often occurs, that there is a swelling of the ear, stagnation occurs there, apparently venous, poor lymphatic drainage. These are the conditions for all this to accumulate. The mucus swells, so those who have problems with breathing don't neglect the sternocleidomastoid muscle either. Look at how it can be trained. For example, one of the ways, if you've never trained before, it's better to start like this. You lie on your side like this, and in this position, just hold your head up on your side. See how it is. Free. No, it holds. If you have weak muscles, in this position, your head might even sag a little. You will feel some tension. That is, such a small static tension. Check on the right. On the left, see if there's a difference. Well, for example, try to hold it for 20 seconds on one side and the other. So on one side, then on the other side like this. See if there's a difference. Here, touch it. It's getting tense. At the moment when you're lying like this, your head is not resting on the pillow. It's hanging in the air. Here, continue. If everything is in order, if it's not hard for you to hold, try to do it in motion. That is, a small movement here. You tilted your head and then lifted it. You don't need to lift it too high. Tilted, lifted. but there will already be some strain felt even by those who don't have such a pronounced weakness. Start with 10 repetitions, 10 to 15 repetitions on one side and the other side. Do it in a row like this. 1, 2. From one side, from the other side. You've bent over, stretched it a bit, and lifted it back up. Here's the pectoral clavicle scapular muscle. First workout. Second method. Here you are already lying on your back. Turned the head and lifted it in this position. It is also under tension, in static. What's the difference between the first and second exercise? The fact that here, with such a lift, the chest part will be trained more, while in the previous one it was the clavicular part of this muscle. There you go, whatever you need. Some will find one difficult to do, others will find the other. And here too, you lifted, lowered, lifted, lowered. In this position too, do 10 repetitions to one side, turn your head, 10 repetitions to the other side. Then, the next exercise. Here it's more static. You've already lifted yourself to the edge of the bed and just hold in a static position with your head hanging. Here, for example, if someone needs to reduce the tension in the area of the second and third vertebrae, you can also use this exercise. Because at the same time with the sternocleidomastoid muscle, the subcutaneous muscle of the neck also works here. It also gets a good workout. We have discussed the sternocleidomastoid muscle with you. It is advisable to do these exercises, well, 2 or 3 times a week, if your task is simply to keep them in good condition. And pay attention that after these exercises, your head will slightly straighten up. It will no longer hang down. And the rotation will improve because the scalene muscle will be unloaded. The load will go to a larger, more powerful muscle. We had the anterior muscle group, now the posterior muscle group. This is a long neck flexor. Here are 2 options for how you can load it, both in static and dynamic. What could be the static load? For example, we take a soft pillow with you. You lie down as you usually lay on a pillow. Put your head down. You can just use a regular pillow. And you start to push it, press it with the back of your head. Here's the peculiarity. Look what it is. For some reason, I don't know why, but if you look, who came up with this? It's unclear. If you look at many neck exercises, you'll see that they advise doing them this way, even turning sideways like this, that you need to pull a spring for some reason like this and press exactly in this way. This is an unnatural position for the neck. In this position, there is a risk that you will injure these ligaments here, first of all. But this is if you press very hard. Secondly, there is no point in such a movement, because both your head is already accustomed to such a position. When you lower your head, such a movement occurs between the occipital bone and the first vertebra. That is, the problem is that the lordosis of the neck is smoothed out. This is a bend. And in this exercise, you are training in such an already incorrect position, without this lordosis, your neck. That is, your muscles get used to holding your neck in a position where there is no lordosis. Therefore, you need to train in a natural position. That is, to extend there when you do this exercise. There's no need to pull your chin in like this for some reason. Who came up with this? It's unclear. What is the purpose of doing this? Ask the person who does this why they do it. That is, we leave the chin in its natural position, so we don't squeeze it like this. Here, and we press. But we don't throw our head back too hard. Just your usual standard position when you're looking straight ahead and pressing back, pushing this soft pillow. You've pressed, hold for 3-4 seconds and slowly relax. The force here should be, well, about 20-30% of your maximum. That is, you don't need to press with all your strength. Here you just need to make a gradual and continuous movement. Pressed. Held for 3 seconds and relaxed. Pressed again and relaxed. The main thing is to also relax gradually, slowly. Then the right one, the left one, to train the muscle separately. You turned your head, but so that you looked under 45 degrees. And you make the movement also back and forth. Once again, back and forth. That's it. You turn to the right side. To the right side of your head, your nose is already looking to the right, and you do the same. That's it. That is, you have 3 positions, straight to one side to the other side. This is a long neck flexor. There is also an exercise to increase mobility and simultaneously increase blood flow to this part, to the occipital. This is also very useful, but here you need to calculate in general your strength. You put your hands on the back of your head like this. You tilt your head, and from this position, you make such a forward movement. Here you can do a few variations. For the first and simplest technique, place your hands like this without pressing hard. The weight of your hands is enough. Then, bend in this manner. Without any particular pressure, the weight of your hands is enough. Do it 10 times as well. The second option is when you don't put your hand back, don't press in this direction, but you put your hand here to the side and apply a little pressure in this direction. Press your head against your hand and your hand against your head, and do exactly the same movement. Forward, backward, forward, backward. And here, you will be training these muscles at a slightly different angle. And at the same time, the sternocleidomastoid muscle will also be engaged. It's also a good exercise. At the same time, you will be increasing the mobility of the joints between the vertebrae, restoring mobility. Well, friends, all that's left is to make yourself get up from the couch. This can be done lying down without even getting up. Well then, that's all.